Hi everyone, welcome back to my channel. I hope you're all doing wonderful today. If you don't know me, my name is Nee and I have stage 4 cancer, and I started this channel so that I can document everything that I'm doing and share some information with you guys. Today, I'm going to be talking about the Herxheimer's reaction because I recently experienced this and I really wanted to make a video so that you are aware of what this is and how to prevent it and how to treat it if you're going through the same thing. So the Herxheimer's reaction was coined back in the late 1800s when they were treating patients with syphilis. So these patients had these infections with spirochetes, which are the same bacteria that causes Lyme disease and syphilis. So an Austrian dermatologist by the name of Dr. Adolf Jarisch noted that these patients that were treated with antibiotics for syphilis developed these reactions within the first 24 hours, such as flu-like symptoms and rashes. And so he realized that that's what it was. And so the reaction was named the Herxheimer's reaction, named after him. So this is more specific to spirochete infections and bacterial infections. However, now there's more information that this phenomenon happens when we kill any pathogens like parasites, bacteria, and fungal infections, such as Candida and other bacterial infections like H. pylori. It can also happen when you change your diet, especially when you cut out processed foods and processed sugars, carbohydrates, which generally feeds the pathogens in your gut. And when you change your diet drastically, this can lead to the die-off symptoms as well. So I'm going to refer to this reaction as a die-off syndrome or a die-off reaction that happens, instead of calling it the Herxheimer's reaction, because that's more specific for the spirochete infections. So for me, what happened was I started taking M3bendazole, which is an antiparasitic. It's very strong and it works very well against cysts, and it crosses the blood-brain barrier. And I started M3bendazole, and then I also took ivermectin at the same time. And then I also went on the ketogenic diet. So I eliminated all of the refined carbohydrates and sugars. And so there was a drastic change all at once. In terms of the die-off symptoms, there are 3 phases. So the first phase is the cell death. So what happens when you take these antibiotics or antiparasitics, whether they're prescription medications or herbal medications, or if you're altering it with your diet, what happens is that these pathogens, they have biofilm that they develop, and the biofilm is like the sticky material, and it acts as a barrier for the bacteria or the pathogens and allows them to clump together and stick to the gut lining. So it helps them evade the immune system and helps them survive. So when you take the antibiotics or the antiparasitic medication, it kills off the biofilm, and thereby it releases the individual pathogens and spreads them out. And so now they get released into your gut, and then sometimes they get into the bloodstream, and it creates this immune response because of this pro-inflammatory state. So that all of this inflammation will then trigger the immune response. So that's the second thing that happens, is that all these cytokines and inflammatory markers as a result of the toxins that gets released will then cause this immune reaction to happen. So in terms of the toxins that gets released, they're called these glycoconjugates. So it's a more general term because bacteria and parasites and fungus all has different types of things that they send out. Like the bacterial infections can have endotoxins, and the parasitic infections will have glycolipids, and then the fungus like Candida will have beta glucans. So all of these serve as toxins in your body, and your body's like allergic to it pretty much. And so this is very bad if there's a lot of it in there that your body just can't clear out or deal with. And so that's what leads to these die-off symptoms. And it can range between having flu-like symptoms like fever, chills, nausea, vomiting, headaches. You can have joint pains, body aches, just pain in general. You can have extreme fatigue, mood changes like depression and anxiety. You can have gut issues like a lot of stomach upset. And it can also lead to skin changes like rashes and outbreaks on your skin. So there's a lot of things that can happen, and I have actually experienced them all. So what happened was I took the medicines all at once, and I took them every single day. And I did that for about 5 days until I started having the symptoms and got really sick. As you can recall, in my previous video, I was talking about how I was stuck in bed for like 3 days and I couldn't get out of bed. I was nauseous. I was extremely fatigued. I had a lot of pain and headaches, and it led me to go to the ER and everything. So that all makes sense now that I had those symptoms, and I just didn't realize that that's what was happening. I kind of knew that it had to do with the medications I was taking, but I didn't realize that it was specifically for this reaction. And so I kind of just realized that recently, and I spoke with my integrative doctor and he agreed. So basically, I just had way too much die-off and my body just couldn't handle it, because the next phase in it is the detox phase, where once these pathogens and toxins get released and they die off in your gut, your body will then have to clear them through the detox pathways. And people who already have these infections tend to have leaky gut and not a very good detox system in general. So things will get clogged up and actually then recirculate into the bloodstream and then cause more severe reactions to happen because it's not getting eliminated. And so the elimination process, of course, goes through the stools and through sweat and things like that. So there's things that you can do to help with the detox pathways, which I will go into. But basically, that's what happened to me. And I think I was making it worse by not drinking water, not eating, and I wasn't taking anything to help myself detox. So I instinctively just kind of stopped the supplements and stopped the medication for almost a week, and I started to slowly feel better. So I decided to watch a video with Dr. Lee Merritt. Not sure if you've heard of her, but I was doing a lot of research and I came across her video where she talked about the antiparasitic protocol that she uses, and she made some really good recommendations. This is not medical advice at all. This is just what I found, and this is just what I did. So this is not intended for medical advice, okay? So she used 2 different medications, and she chose M3bendazole and nitazoxanide, which is similar to niclosamide, which is what I was prescribed, and then M3bendazole is very similar to M3bendazole. So I guess you could say they're kind of in the same type of mechanisms of actions and stuff like that. I used ivermectin, she did not, but she recommended using different medications in combinations because it works synergistically together and it will kill different aspects of the parasite, because you have the live parasites and then you also have the cysts, and then there's the mother parasite, and then there's like the baby parasite. So what she was saying was that if you took the medication just once, or if you took it multiple days in a row and you're not pulsing it, then you're not giving yourself enough time for the babies to hatch and then for you to kill it. So what happens is that when the mother parasite is alive, they release this hormone which causes these babies parasites to stay in the cyst form and they don't hatch. And so when you kill the mother, then that hormone is no longer released, and that allows for all of the babies to hatch. So now you have all these hatched parasites that you have to deal with. And so the idea is to take the medicine, give it a few days, and then once the baby parasites hatch, then you can then take it again and then kill all of that off, and then your body can handle that. So if you wait too long, then it may be overloaded with all of the parasites that have hatched, and then now you're dealing with a lot, and then you are more prone to getting the die-off symptoms. So if you wait too long, then that's not good. If you take it too early, then you're overloaded, and that's not good either. So after I watched that, I decided that I was gonna resume the mebendazole, and I did it by itself without the ivermectin or the niclosamide, and I didn't take it with any supplements either because I just kind of wanted to restart it one at a time. So I took it for 2 days and I felt okay, but then I went to the gym and I had a personal training session, and it was very light. It wasn't anything crazy, but after I got home from that, my body just started flaring back up again. I had so much pain in my arms and legs again, the shooting pains, and then my palms and my feet were so itchy. Like I felt like I had to scratch it the whole night, and I just couldn't sleep. It was pretty horrible, and I was still feeling pretty fatigued, and I had a lot of joint pains. My joints were stiff. So I figured that was part of the reaction, but I didn't want to stop it after 2 days. So I took it for 3 days, and then I took 4 days off, and that seemed to help. And instinctively, I guess I knew that I could speed up my detox pathways by going to do an infrared sauna session. And then I also took some ginger, turmeric, black pepper tea, and then I took some ginger shots, kind of like an immune boosting. I ate some fruits like watermelon, which helped me detox and get hydration, electrolytes, and all that. So I kind of incorporate a little bit more fruits and vegetables instead of going strict keto carnivore type of style for about a week or so. But now that I'm feeling better, I'm kind of back on not eating fruits and stuff. Going into what you can do to help yourself now that you know what the die-off symptoms are and why it happens, what you can do for it. Number one is a dose reduction. So obviously, you know, if you're going too aggressive and you're getting a lot of die-off, your body can't handle it. So what you would do to help that is to reduce the frequency of how often you take the medication or the herbal medication, kind of modify your diet if it's secondary to dietary changes. And then you could also decrease the dose of whatever you're taking if you're going to be taking it on a daily basis. So for me, I just reduce the frequency so I can pulse it. And then the second thing you can do is to decrease inflammation in your body. So that's eating anti-inflammatory foods, taking supplements to help with inflammation like turmeric and fish oil and boswellia. You know, there's a lot of supplements that you can take that can reduce the toxicity. I didn't really take that much supplements because, again, I didn't really want any bad reactions and I wasn't sure what was causing it. So I mostly just ate a more anti-inflammatory diet. And then the other thing you can do to help it is to improve your detoxification pathway. And that can be with things like the infrared sauna, which I mentioned, some herbal stuff like the ginger. You can also take binders or activated charcoal. I didn't have to resort to that. I do have activated charcoal, and I was going to take it, but I felt better, so I guess I didn't really need to do that. So those are the things that you can do to help yourself not get as bad of the symptoms. And just to give it time, I don't know how long it usually goes for because that varies between individuals. And I think for the purposes of cancer, the dosing of mebendazole and M3bendazole, it's really not clear because some people take it every day, some people take it a couple times a day, some people take it 3 days on and 4 days off, etc. So there's a lot of different ways that you can take it. I know that Joe Tippins was talking about how he used to take it as 4 days on, 3 days off or something like that, but now it's a daily thing that he does, and he thinks that that's safe. And there's a lot of people doing that. I think for me, I'm just going to stick to the pulsing for now until I feel better, and then I can resume it daily. And I spoke with my integrative doctor, and he recommended that I take all three at the same time for the synergistic effect. So I'll be taking the ivermectin with the mebendazole. The mebendazole will penetrate through the blood-brain barrier, and it's good for killing off cysts, whereas ivermectin and niclosamide can target the gut parasites. So they work in different ways, and they are synergistic to one another. I haven't added the niclosamide yet because I want to see how I feel with just the ivermectin and the mebendazole first, and then I'm going to add that later on. And that's my plan. I went to the gym yesterday, and I feel good. My body is getting back to normal. The pain is going away. I've had more of an appetite, and I've been able to eat more, so things are looking good. And for the first time yesterday, my rib pain was not there, and I was so surprised. I'm like, oh wow, I don't feel any pain right now. And I even went to work out. So that was really great. And I was able to sleep at night. I was able to sleep on my right side, which I haven't been able to do for months now because of the pain. So I feel really, really encouraged by this, that everything that I'm doing is working. I am taking a bunch of repurposed medications, which is a pretty important part of the metabolic therapy. So I'm going to make a separate video about that to talk about all of the ones that I am taking and why I chose to take it, the mechanism of actions behind these drugs, and I'll also talk about some common ones that are used in care oncology, which is this service that they have where there are doctors that can prescribe these repurposed medications for patients in regards to treating their cancer with the metabolic therapy. So that's going to be pretty interesting, and stay tuned for that. I am also going to add one more repurposed drug to my list, and it's called propranolol, and it works really well for my type of cancer because what it does is it blocks angiogenesis, which is blood vessel growth, and it blocks some growth factors like VEGF. I just have to be careful to monitor my blood pressure and heart rate, and I haven't started it yet, but I just got prescribed the medication. I've known about it for a long time, but I was pretty hesitant on starting it. I've known about repurposed drugs in general for a long time as well, but I really, at the time, I didn't feel that I needed to take them yet, and I kind of wanted to stay with all the natural products and everything. I didn't really want to take prescribed medications, but I think at this point I really have to step up my game and just use whatever it is that I can in order to keep this cancer under control. It's not a game anymore, and I've had some serious problems that I've had to deal with, and I just don't want to have any more setbacks. So I think trying to get on the right protocol and the right regimen with as least side effects as possible is basically my goal. So yeah, so this drug is pretty promising, and it's very similar to the tyrosine kinase inhibitor that my oncologist wants to put me back on, except that one has way more side effects. So I don't want to necessarily be taking that when I can do some other things to help myself. That's it for today's video. Thank you so much for continuing to support my channel, continuing to follow my story, and taking the time to comment and help me out. I mean, I've received so many private messages and emails and comments from people who are giving me resources and, just bringing things up that may help me. I mean, it really, really warms my heart to know that complete strangers are willing to help me out. I mean, it just means so much, and it just restored all of my faith in humanity and how kind people are. And I just love it. I love all the suggestions, and there are some things that I haven't heard of that I would love to research. And so definitely just keep them coming my way. I mean, a lot of these things I have heard of, I just haven't really utilized them. So sometimes it just kind of jogs my memory. So I really love that You all are so wonderful, and thank you so, so much. If you haven't subscribed to my channel, I would love it if you did, so that you can keep following my journey and seeing what I'm doing. And the goal is to beat this cancer, and I am on my way to being cancer free. That's what I keep telling myself. So thank you all so much for listening, and I'll include some of the stuff at the end of my weekend. And I celebrated my anniversary with my husband, and so I'll add some clips of that you can watch and see. Okay, all right, see you in the next video. Bye.